Every year, WHO celebrates something we call World Health Day. World Health Day is our birthday, and we use it to call attention to an important global health issue. And this year, it was food safety, because unsafe food contains bacteria, viruses, parasites, chemicals. It can cause up to 200 diseases. Many of them can be prevented with proper food production, handling, and cooking. Let's take a look.
In a remote village of South America, these women receive a training about WHO's campaign entitled 5 Keys to Safer Food. Everywhere in the world, people deserve the right to safe and nutritious food. Yet today, more than 200 diseases are caused by unsafe food containing harmful bacteria, parasites, viruses, or chemical substances. Everyone who grows, manufactures, transports, stores, sells and prepares food, or implements governmental regulations, needs to be educated and get involved. In April 2015, to draw attention on this global issue, WHO launched a campaign on food safety at the Rungis market in Paris, one of the largest international food markets in the world, in the presence of Dr. Margaret Chan, Director General of WHO.
In this Rungis market, where I see the Ministry of Health, the health people and the agriculture people working with the industry, the wholesalers, they are fully integrated to make sure that the quality of food that they are, distributing to different markets, is safe. Choice is important, but quality is equally important, and every individual can contribute to food safety. It is everybody's business, from the farm where they produce, where food are distributed, as in the case of the wholesaler, and to your home. You prepare food at home, you eat food at the restaurants. So along the entire food supply chain, every individual can make a contribution to food safe. Safe food is good for the country's economy, it's important for trade, and it's important for tourism, and this is important for the country's reputation as well.
Now joining me now to talk about food safety is Dr. Kazuaki Miyagishima. He is our Director of Food Safety at WHO. Kazuaki, talk to me about this. I think food safety issues are far more prevalent than many people realize. What kinds of diseases are we talking about with food safety?
People can easily imagine diarrheal diseases because it is even easier to establish the link between the symptom and the food you eat or the wrong food you ate. But in terms of long-term effects of food safety, we have a range of chemicals that may cause cancer, that may cause other handicaps to human beings. So in that cases, the causal relationship between the agent and the effect is not so clear to the victims of the situation. So this is the reason why we need to cover the whole range of foodborne hazards.
So where do the problems come in? When you're looking at how food is grown, how it's shipped, how it's cooked, how it's served, where do the problems that cause food safety come?
Well, the problems may come from any point. That is the tricky part. Let me explain. Today, some people may eat food that they grow themselves or they catch themselves. But this is only a small fraction of the world population. The huge majority of the people eat food that is produced by somebody else and transported hundreds or thousands of kilometers to the place of consumption. So this is a reason why we face a big challenge, because conversely, you may eat the food which is produced by somebody who you don't know. Or you are producing food and you don't know who is going to eat the food you produce.
So you don't know how it's been handled and whether or not it's been handled in a safe way or cooked in a safe way. To what degree is globalization of our food supply making the problem worse?
Well, globalization may make the problem worse or even better.
Okay.
It depends. Thanks to the globalization, the population in the world can benefit from a bigger and better variety of foods at affordable prices. And that is a benefit of trade we need to recognize. But however, if the fruit is traveling thousands of kilometers and through the hands of different food operators, if something goes wrong, it is very hard to track down. And by the time you find the reason at the point of contamination, the food may be already shipped to thousands and hundreds of different countries, and even most of them consumed. And this put the enormous challenge on us. And now the information exchange has become a big key. The time is over where the foods are grown in one country and consumed in the same country. Now we have to put in place a system to exchange emergency information between countries.
So what is WHO doing to improve the safety of food supply around the world?
Well, we have a range of different activities. Let me quickly start with standardization. Because foods travel across the borders, it's not good enough to have one country own standards to regulate foods. I think we need a common international standards and the safety standards for major commodities that are traded. And we established 50 years ago within the UN system the Codex Alimentarius Commission to develop food standards and agree on internationally on the common standards. But we need a scientific basis. We need good toxicology, we need good epidemiology to advise this food standard setting process. So WHO provides scientific advice to this process. And we need to revisit the same chemical, the same compounds repeatedly as and when new evidence becomes clear. And also WHO's one important program is to help countries to put in place decent food safety regulatory mechanism. It may be legislation, it may be laboratory, it may be training. There are many, many fronts we need to work. And finally, we want to facilitate information exchange between member countries to better manage food emergencies.
All right, so let's take it down into the home for just a moment. One last question for you, very briefly. What is the most important thing that people can do to keep their food supply safe? What would you say?
Well, what I would say is to observe good practice, good food handling practices, which everybody can respect. Our flagship product for health education is 5 keys
Show it to that camera over
to
there,
safer
I think.
food. 5 keys to safer food. And this guidance is translated in more than 70 languages and used in more than 100 countries to train restaurant staff, street food vendors, the staff working in school canteens, home and women's group. And this is very simple 5 keys to observe, and then you can eliminate a lot of risks from what you eat.
What are some of those 5 keys?
The first is that to use safe food and safe ingredients. Second, you have to keep your hands and cooking environment clean. Third, you have to separate cooked and raw materials. And then you have to apply, for instance, to cook 70 degrees Celsius to eliminate harmful bacteria. And after cooking is over, keep your food at safe temperatures.
There you go, straight from our food safety team. 5 things you can do to prevent foodborne illness and stay healthy while you enjoy your food. Kazuaki, thank you so much for joining us.
Christy.
All right, appreciate it.